Hello friends, I am Dr. Sarika Swami and today I am here with the video that will tell you knowledge about the neonatal resuscitation program, especially the first golden minute. And you might be knowing that 10th May 2026 is National NRP Day, and this year it is going to be a historic day as many of the personnels are being made expert in the neonatal resuscitation, especially the first golden minute. So let's proceed. So, key themes for that day, the 10th May is empowering hands and saving newborn lives, because through this day there are so many providers, more than 10,000 providers are being trained in this neonatal resuscitation program, and that will make the history, and together we can do that. And the theme for this is One Nation, One Mission, save newborn lives one breathe at a minute. So there are more than 1000 places where this course will be conducted tomorrow. So I do have a disclaimer that this video aims to spread knowledge about neonatal resuscitation, especially first golden minute, and hands-on training is essential for one to be a basic course provider of neonatal resuscitation program. Now we will discuss this topic in key headings, which are anticipation and preparation at birth, routine care, initial steps, then brief ventilation, prolonged ventilation with normal heart rate, and prolonged ventilation with slow heart rate. So let's move to the anticipation and preparation at the birth. So keep in mind that there are certain high risk conditions which make the newborn prone to be compromised at the time of birth, and such a neonate may need resuscitation. So some of these factors are, if the baby is going to be born before 37 completed weeks, that is preterm baby if it is, or if it is a post-term baby, that is if baby is delivering after 41 completed weeks of gestation. If the baby is having, if the mother is having hypertension, or mother is having pre-eclampsia or eclampsia, or mother is having antepartum hemorrhage in the form of abruptio placentae, or if she is having placenta previa, or she is having any chronic disease, or there are chances, if there is passage of meconium, then there are chances that the coming baby may be at risk of difficulty in breathing, or may need resuscitation. So what we have to prepare after getting the risk factors, we can know that from our gynecologist colleagues, and they will tell us that how the baby that is coming may be at risk of difficulty in breathing. And the second thing is that if any child, any baby at birth can need resuscitation, so you have to be alert in every delivery. Then we have to switch off the fans, draw curtains to avoid draught of air, so that there is no flowing air, because if flowing air is there, then that can cause heat loss from the body of the baby, skin of the baby, and that can lead to hypothermia. So we have to make the area drought free. Then we have to switch the radiant warmers at least 15 to 20 minutes before the delivery, and the delivery room temperature has to be kept between 26 and 28 degrees centigrade. We have to check all the equipments, which I am going to tell you in the next slides. Then we have to essentially check the functioning of the equipments, and we should know hand washing and wearing gloves. So here you can see very well the various equipments which we use during the time of resuscitation or at the time of birth. A radiant warmer which is preheated, then a cord clamp and a sterile surgical blade or a scissors to cut the cord, then a timer we should have, or we should have a clock that is having second hand, and then 2 sterile linen which has to be pre-warmed before receiving the baby. Then Deely's mucus extractor, or most of the centers might be having suction machine. So if suction machine is there, we have to keep in mind that the pressure should not go beyond 80 to 100 millimeters of mercury. Then we will need a shoulder roll. Then the important one, which is a key equipment of whole the program or whole the resuscitation, is the self-inflating bag with masks which are of various sizes. So generally we use zero size mask for preterm babies and one size for the term baby. So these equipments are very important and they should be kept ready. And for the functioning of the equipment, we should check the functioning of radiant warmer, certainly whether it is heating properly or not, and then suction machine, whether it is properly doing suction or not. And then for the ambu, we should place the mask on the self-inflating bag in a screwing manner, and then we should pump it from the back side. And if it is pressing on your hand, the air is pressing on your hand, that means it is functioning. And there is a important part of the self-inflating bag, that is pop-off valve. So if we keep the mask on our palm and then we press the bag fastly, so if hissing sound is there, then that means that this pop-off valve is also functioning properly, and that pop-off valve is there to avoid barotrauma to the baby's lungs. So we have checked the equipments and now we proceed. So the first scenario is routine care. So as soon as the baby is delivered, we have to call out the time of the birth, put the baby on the mother's abdomen, skin to skin contact with the mother, with head on one side. If if the baby is having secretions, we have to wipe it from the mouth of the baby. We have to dry the baby, and after drying the baby with that warm linen, we have to remove that linen and we have to replace it with the dry linen, new linen. Then we have to assess whether baby is breathing or not. So if baby is breathing well and or crying, then we have to shift the baby for the routine care after clamping the cord. And here one thing important is that we can go for delayed cord clamping in such a scenario, that is we have to clamp the cord after 1 to 3 minutes of birth, so that can benefit the baby. So components of routine care are: baby kept on mother's abdomen, cover both together; delayed cord clamping, help the mother to initiate the breastfeeding, that is an important step which can reduce neonatal mortality. Then we have to give injection vitamin K, and we have to have a watch on the color and breathing of the baby. Then another scenario may be that when we dried and mopped the baby, secretions wiped out, and then we changed the wet cloth, but the baby is not breathing. So in this scenario, we have to immediately clamp and cut the cord, shift the baby under radiant warmer, and then we have to follow the initial steps. So there are 4 things in the initial step which we can remember by PSSR. P is positioning of the baby with neck slightly extended, and we also call this position as sniffing position, because when we sniff something, we have our neck slightly extended, because that will maintain the airway of the baby and that will help the baby to breathe properly. Then if there are secretions in the mouth or nose, then we have to suction it out, and we have to first suck the mouth and then the nose, and take care that while you are suctioning the mouth, you can go 5 centimeter depth, not more than that, and in the nose you have to go 2 centimeters, and you should be quite gentle while suctioning. Don't be vigorous, and because being vigorous or going very deep in the oral cavity, it can cause bradycardia and apnea in a child. Then we have to stimulate the baby by gently rubbing the back, and we have to reposition the head, because by the time we are doing all the things, the position, that is position of slight extension, might have lost, so we have to reposition the baby. Then if the baby is crying or breathing well after initial steps, then we have to shift the baby for observational care. So observational care involves keeping the baby on the breast of the mother, in between the breast of the mother, and starting the breastfeeding, giving injection vitamin K, and then we have to uh, uh, cover the baby and the mother both, and then we have to have a watch on the heart rate, temperature, respiration, and color of the baby. So we have to do that. So then the another scenario comes that needs a brief ventilation. So even after initial steps, if baby is not breathing well, then comes the role of bag and mask ventilation, that is positive pressure ventilation, and we commonly use the term effective positive pressure ventilation. So if baby is not breathing even after initial steps, we have to go for positive pressure ventilation. So for that you should use appropriate size mask, 0 for preterm and 1 for term baby, and with the help of C and E clamp for the mask, C with index finger and thumb on the mask, and rest of the 3 fingers as E beneath the mandible, so as to slightly extend the neck. So for first 5 breaths we have to check for the chest rise, whether chest is rising properly or not. So if in case chest is not rising properly, then we have to take ventilation corrective steps, which are very important, and we should take care of these, or we should keep in mind these ventilation corrective steps. So these are MRSOP. M is readjust the mask, because leaking mask is an important cause of chest not rising. Then we have to reposition the head, and after doing these two, we have to again check whether chest is rising or not. Then we have to, if even still chest is not rising, then we have to do suction of the mouth and nose, and we have to increase the pressure. So opening the mouth may be required in extreme preterm babies who have very narrow nasal passages. So if chest rising is not rising, then we have to take ventilation corrective steps. So once the chest has started rising, so we have to give bag and mask ventilation for 30 seconds, and the rate should be 40 to 60 breaths per minute. And how do we give that? That we have to speak loudly. We have breathe when we speak breathe. We have to press the mask, press the bag. That is breathe 2 3, breathe 2 3, breathe 2 3. In that way we have to go do the counting. And after 30 seconds of effective positive pressure ventilation, we have to check whether the baby is breathing. If baby is breathing well, then we have to wean off from the bag and mask ventilation by increasing the count, like breathe 2 3 4, breathe 2 3 4 5, breathe 2 3 4 5 6, in that way. And we have to stop the positive pressure ventilation. And such a baby who has required observational care will be shifted for observational care, which I have told you earlier. So monitoring, I forgot to tell you, which I am telling now, that we have to monitor all these 4 parameters, that is temperature, heart rate, respiration, and color, for every 15 minutes in first hour, and then every 30 minutes in the next 1 hour. Then one situation may be that baby may need positive pressure ventilation more than 30 seconds. So that is a scenario, prolonged ventilation with normal heart rate. So baby if not breathing even after 30 seconds of bag and mask ventilation, then the things which we should do is call for help. We have to attach the oxygen to the bag. Then we should continue giving bag and mask and assess every 30 seconds. As soon as help is available, we ask our helper to count the heart rate with the help of stethoscope. So here you have to you should know how to count the heart rate. That is, we have to count for 6 seconds, and then we have to multiply it with the 10, so that will give the breathing heart rate per minute, or the pulse rate per minute. So if baby requires that, then we have to continue. If heart rate is more than 100, then we have to continue with bag and mask, and we have to check every 30 seconds. And when baby is uh, has started breathing, then we have to shift the patient for post resuscitation care. So any ventilation which is required for more than 1 minute, we have to shift such baby to post resuscitation care. So here I have written 30 minutes, but please correct it, it is 30 seconds. So one situation may be prolonged ventilation with slow heart rate. So here certainly you need the person who is expert in intubation and giving medication and all that. So as soon as help is available, we have to check for heart rate. If heart rate is less than 100, then we have to intubate the child. If heart rate goes beyond below 60, then we have to start chest compression, and we may need to arrange for referral of the child. So but at the end, I would like to tell that if the which is the motto of this NRP day or this video, is that if any child need resuscitation, then it should be started within 1 minute. That is the first golden minute, and that can save so many lives. So thank you very much for watching this video so patiently. Thank you so much.